Hey everyone, and welcome to another episode of Medication Monday. Medication Monday is a quick little mini series that airs every single Monday where we highlight a different drug or medication that's administered out in the EMS field. And we do this specifically in EMT drug card format for you guys. It should go without saying, but I'm going to say it anyway. Please abide by your local protocol and scope of practice. Today's drug is called ondansetron. And ondansetron is more commonly known in the EMS field and just the medical field in general by its brand name, which is Zofran. Zofran falls under the class of antiemetics. So how does it work in the body? Basically, ondansetron blocks the action of serotonin in the body, which a lot of times can be the cause of nausea and vomiting. It's also a 5-HT3 receptor antagonist. Your indications are pretty cut and dry. It's going to be for nausea and vomiting. And before we get into doses, I just need to put a little disclaimer like I always do. Please abide by your local protocol. This dose is pretty standard across the board, but protocols vary, so just be aware of that. All right, your dose for an adult is going to be 4 milligrams via IV, IO, oral, or intramuscular. Your pediatric dose is going to be a range of 0.05 to 0.1 milligrams per kilogram IV, IO, oral, or intramuscular, and it's going to have a max dose of 4 milligrams. There aren't a ton of contraindications with Zofran. You don't bump into too many people that have known hypersensitivity or allergies to Zofran or the related agents, but it is something that you will want to hold off on if the person has a congenital QT syndrome. Your adverse reactions can be a headache, a bronchospasm, abnormal EKG, atrial fibrillation, and a prolonged QT interval, and possibly gastric discomfort. If a patient is given Zofran in conjunction with apomorphine, they do run the risk of severe hypotension with a loss of consciousness, so it's not recommended. And if I'm not mistaken, apomorphine, typically you see that medication prescribed in patients that have Parkinson's disease. How ondansetron is supplied. You most commonly see it in 4 milligrams in 2 ml vials, and you may see them in the 4 milligram oral dissolving tablets as well. Okay, a few side notes about ondansetron. You want to avoid giving it in patients that have congenital QT syndrome, which we kind of talked about in our contraindications, but Zofran can be very dangerous in these patients. Also, it tends to be more effective if you give this medication before the vomiting begins. I find that in the field that Zofran is very effective if you give it to patients who are just really feeling nauseous and sick. I learned in paramedic school, Zofran is what you give before and promethazine is what you give after. And this is not the case always, obviously, but it is something that I've noticed tends to work better. So just be aware of that. Also, ondansetron is very beneficial in patients that may have had chemotherapy due to cancer or some other condition, because chemotherapy is linked to the release of serotonin in the body, and as we know, ondansetron blocks serotonin receptors. So it usually is very effective in these patients, and they usually have a prescription, but if they don't, it's always a good option to go with Zofran. When it comes to pregnancy, Zofran is said to be the safer antiemetic in comparison to like promethazine or something that alters the mental status or depresses the CNS system in some way. So just be aware of that, and also be aware if your patient is under the influence of narcotics or alcohol or something like that, Zofran may be the better option because promethazine and other antiemetics are going to potentiate the effects of the narcotics and the alcohol. Remember to abide by your local protocol and scope of practice always. This is purely informational for those in the EMS field and never meant to be used in the place of your local protocol. I hope you guys have a great week. Bye!